blood pressure monitors, generally NIPB monitors, non-invasive blood pressure monitors. NIPB is an essential indicator of physiologic condition. As one of the most frequently used diagnostic tests, it indicates changes in the blood volume, the pumping efficiency of the heart, and the resistance of the peripheral vasculature. Vital sign monitors are used to measure basic physiologic parameters so that clinicians can be informed of changes in a patient's condition. Depending on their configuration, these units can measure and display numerical data for NIPB, oxygen saturation, and even temperature. So how do this machine look like? It is an automatic electronic sphygmomanometer, non-invasively measure and display a patient's arterial blood pressure. The main unit includes the controls and display. It also includes the appropriate attached cuffs, probes, and sensors that make possible sequential or simultaneous measurement of the parameters. Some of the NIPB monitors can be used as a vital sign monitor with a real-time measuring display of two or more than vital signs. These monitors typically consist of portable or mobile electronic units. This monitor may be connected to a line or powered by internal batteries. Many devices may also perform continuous monitoring during transportation or even at the bedside. The vital signs physiologic monitors are intended mainly for periodic automated measuring of the parameters of one or more patients. So how do they operate or how do they work? Automatic electronic sphygmomanometers or NIPB monitors measure by the use of sound and the detection of blood sound turbulence or Colonoscope sounds. A microphone positioned against an artery compressed by the device cuff detects the Colonoscope sounds, enabling the unit to directly determine the systolic and diastolic values or the blood pressure values. NIPB is usually measured using cuffs and either oscillatory or oscillatory techniques. The measurement of temperature is typically accomplished using an intraoral sensor and SpO2 is determined using a pulse oximetry sensors. These monitors typically consist of portable or mobile electronic units that facilitate the movement from one location to other. The monitor may be connected to the line or powered by internal batteries. Devices that are introduced at the nose or mouth to observe the distal branches of the bronchi. Through the working channels in the bronchoscope, the physician can sample lung tissue, instill radiographic media for the bronchographic studies. They perform laser therapy even, remove foreign subjects, suction sputum for microbiological culturing, even they insert catheters and perform difficult intubations. The device consists of a proximal housing, a flexible incision which is of 0.5 to 7 mm in diameter, and an umbilical cord which connect the light source and the proximal housing. The proximal housing, which is designed to be held in one hand, typically includes an eyepiece, the controls for the distal tip, angulation and a suction, and the working channel port. So how does this equipment work? So this bronchoscope is inserted into the airways, usually through the mouth or nose. Sometimes the bronchoscope is inserted via tracheostomy. Rigid bronchoscopes are used for the removal of foreign bodies, while flexible video bronchoscopes are intended to provide images of a patient's airway and lungs. The images provided by the bronchoscope can be focused by adjusting the ocular on the scope's proximal housing. A video bronchoscope uses a charged coupled device or CCD located at its distal tip of the scope to sense and transmit images, replacing the image guide and also for eyepiece. These images can then be recorded, printed, stored on digital media or transmitted to another location for simultaneous viewing. Colonoscope are used for the removal of foreign bodies, excision of tumors or colorectal polyps, and the control of hemorrhage. Routine colonoscopy is important in diagnosing intestinal cancer. The second leading cause of the most cancer deaths in the United States is intestinal cancer. So guys, these endoscopic procedures reduce the need for invasive surgical diagnostic and therapeutic procedures. So in this, I'll have to talk about how this equipment looks like. Let's talk about how this operates. This machine. So the video colonoscope insertion tubes contain a fiber optic light bundle which transmit light from the light source to the tip of the endoscope. Each fiber optic bundle consists of thousands of individual glass fibers coated with glass causing internal reflections that allow light transmission through the fiber even when it is flexed. This light is used to illuminate the field of view in the patient's colon. The video images are detected by the CCD and they are then transmitted to the video processor, and then they display on the monitors or even the recording devices. So how these steps work? So the patient is typically laid on his or her side on a procedure table. Patients typically will require anesthesia or conscious sedation before insertion of the colonoscope. The colonoscope is inserted into the colon via the rectum by a gastroenterologist. These video images are typically viewed throughout the procedure on a video monitor. These images can then be recorded, printed or stored on digital media, or even transmitted to another location for simultaneous viewing. So this gastroenterologist manipulates the direction of the device using the controls of the colonoscope control housing.